Yeah, if she's in pain right now with that, it'll take her about a month, because, you know. So. It's almost better one of you guys need to move into that apartment. Okay, so let's see what we can do. Ooh, hurts. Okay, are you doing, come forward? Okay, so what I'm seeing here, so come forward, is a lot of tightness here. Okay, so you do need to do more dangling position. Okay, and I think the other half is because you don't have a decent sitting system. I mean, the chair is nice and soft, but the problem is you're in this concave position. So sit in the regular chair as much as possible at home, okay? So now come forward and just dangle. And then just have this arm dangle. There you go. And then now turn and look over to your right. Put your hand in, relax this hand. Just turn and look. So you just kind of dangle this arm, okay? So now you're going to use that arm and just kind of like doing this. And you're moving, but it's really from your shoulder. There you go. And then come back. That's it. And then bring it across. Just use more from your back rather than thinking shoulder. More from your back. So use this back. Okay. So let's try it on the other arm so that you'll know what I'm talking about. So see, don't rely only at the shoulder joint. Move here. You see? Use your back. You see what I'm talking about? So turn with your back, tilt your back to the side. There you go. Okay? Now try it with this arm. Use your back. Use your back to help you together with your shoulder. Okay, so do it again. We'll put it in here. So back and shoulder together. That's it. And then back and shoulder together. Good. Put this hand here. And then back and shoulder. There you go. Okay? So let's scoot yourself to the edge of the seat. Okay? Lean over here on your elbow here. And then bring this arm over here. Use your back. Use your back and shoulder. That's it. Use your back and your shoulder and take your elbow back. There you go. That's it. Okay? Now come back up all the way. What's that? Now straighten up. Okay? Now, when does that hurt anymore? See? Isn't that cool? See, because when all of these muscles get tightened up, it's going to pull all the way up to the fingertips. Then you get like, then that's when it's get painful if I try to extend it. But now that we just loosen up here, that helps. Okay? So then you can also use this hand and just slide it down. And then use this hand. Keep your hand. See if you can lean onto your hand. Kind of using that hand, lean onto it. Good. Lean on, but allow sliding. So does that make sense? Allow sliding. Okay, so go ahead. Slide that hand. Slide this hand. So you do it. Okay, now slide the hand down. Okay, let that arm go down. Get the elbow out the way. So we don't have the full control of it yet. So we're going to use it to help. So the caregiver is going to help. So go ahead and slide it down. So I'm just holding it. She's doing all the work. Okay? Just holding it and bring it back up so she gets the idea of leaning onto it. Okay, and then slide it down. Okay, and then pull it up. All the way up. Okay, and then straighten up. Okay, now look ahead. That's it. Okay, good. Okay, see if you can transfer over here. So lift, I'm going to move this out of your way. The brakes are on. That's good. So what you want to do is you want to angle your feet over here. Then lift your buns up and scoot over to the left, to the right. No. Okay, what you want to do is lean forward, lean into here, and then now lean into your feet. Use your back and lift you up. Lift up the butt. Push into here. Lift your bun up. There you go. That's good. So lean forward and lift the bun. Okay, stop. Stop. Go back down. Okay, you need to do that evenly with both legs. Okay? The reason you had a hard time, most of the push was from this leg, right? Okay, you need both legs because you got two buns. Okay? So lean forward and use your back. So lean forward, use both feet. Lean into it. But don't push this away. So what happened is, straighten up and rest. Just sit back. Okay. So what the tendency we do is we use this to push away thinking that will help us get up. It doesn't. So the mechanic, if you use the muscle and push this away, what's that going to do with your back? You're going to push back. Okay? When I ask you to lean on here and lean into your feet and bring yourself forward, you're not going to fall. It looks like you're going to fall, but you won't because I'm in front of you. If you lean forward, your body is leaning into the floor. But if you push here, the feet have no choice but to push with the hand, and you're going back this way. That's why you have a hard time standing up. Okay, but the mechanic is, if you lean onto here and lean into your feet, and if you bring your head forward, so it's like somebody's going to pull, so there's a string on top of the head. Somebody pull that string, and that's going to lift the butt. See, this whole force is doing this. Okay? So you lean into both feet. That's the mechanic of it. So you do this, and you're going to come right up. And then you do this, and then you swing. So that's why I wanted your feet angle here. So if you come up, you lean forward, and then all you have to do is your butt swing. You don't even have to move your feet because you're already in position. See, so if you're already in position, you just do this and here. Okay? So that's why I want your butt go toward the right. So lean forward and move your butt. You move your butt to the right. Lean into your feet. Lean into your feet. There you go. You see that? Okay, let's do it again. Lean into your feet onto the left. Lean into it to your left. Lean into it. Lift the butt up. That's it. Did you see the power? You saw, yeah. Okay? So that's your homework. It's just to practice that, and then you'll get the hang of it to come up completely. Okay? You will not fall leaning into it because you're leaning into the floor and you have the control. See, it's like this. It's when you push away, you lose balance. Okay? So let's try it again and then come over here. See, you're already angled here. Okay? Now lean forward and bring yourself over there. Lean. And both feet. Lean into both feet. Lean into the hand. See, I can tell when you're not helping because her hand was more like this rather than fully into the palm. So that's one of the things to look for. Okay? If your hand just at the fingertip like this, there is no way. I mean, you got all this body weight relying on these digits only. Okay? Your whole palm needs to be there. That's where the strength coming from. It's the palm of your hand. So lean into it, and then put your head toward the left foot, and then lift up, push. There you go. That's it. So do it again. And then I can do it in increments. You don't have to do it all a big shot. One, lift, lean. There you go. So I'm just guiding. Okay? Now readjust yourself. And at all times, lean into your feet. Lean into your feet. Put your head over here. Lean into the feet. Use your left side. Lift. Don't push away. Lean into it. Lean into it. Lift. Lean into the sport. There you go. So it looks like I'm pulling her, but I just give her that feeling that I'm hanging on to, and then that's enough security, and then she did the work. So caregiver has to slow it down at her pace and wait for Carmelita to initiate the movement. Okay, so we can come forward like this, and the caregiver can just go yank and come over here. But the problem when you caregiver do that, your timing is off. Her timing is still delayed. And then all she learned is to rely on the caregiver to do the swinging over. So if we have Carmelita come forward and let Carmelita just lean into and guide her, then it's at her timing. As the more you practice, you're going to feel more secure. Okay? But your mind is not on your work right now. Right? It's on stuff at home. And I can tell it's in your face. And when you do that, you're going to delay the progress. So you're really going to need a family meeting and really reassess the situation. Okay? I will help you with relaxing your anxiety and all of that. I can do all that. However, you can't go back home with the same scenario over and over again. You got to be able to go back home in a relaxing atmosphere.
Hopefully Margaret will get better and she can go. She has her own apartment now.
So why don't, I mean, I'm just putting the question. I'm not telling anybody what to do. Can she be there by herself now? She have her own apartment. They have help there.
We told her to go because but she says, oh no, there's nothing there, there's nothing there.
They can also make sure get home health. She's on Medicare, right?
She has Medicare and Medi-Cal.
Okay, get home health care involved. Like we came out to your place, ask the doctor for a prescription for home health. And the nurses can go out there and help her manage her stuff, her medication, and consult with her, just like we did with you. And I think That's what you needed. And she's Medi-Cal. She can look also in home support service and have somebody available. So the service is there. You just need to access it. That's what I would do.
Yeah, I think she needs that support, not just